Good morning, students. We are going to cover edema, and in our today's lecture, we will totally discuss about the causes of edema, and then at the end, we will discuss about features or clinical features of edema. Okay. So we will discuss about the causes of edema, main causes of edema. Then in main causes of edema, we will also discuss the increased reasons of increased hydrostatic pressure and the causes of decreased plasma osmotic pressure, because these are two major things which are involved in the common edematous conditions, increase hydrostatic pressure and decrease osmotic pressure. Then we will discuss about the edema due to lymphatic obstruction. Okay. Then what is the role of sodium and the water retention in body, and why they are important in edema. And edema due to inflammatory reaction is also important. These are objectives of our today lecture. Most important slide from your Robbins pathology, because there are number of MCQs are uh, from there in UHS, like uh, you can see many conditions which are associated with the edema. For example, if we talk about the increased hydrostatic pressure is a major cause of edema, then why hydrostatic pressure is getting increased? So there are two major causes of increased hydrostatic pressure. First of all, impaired venous return. It means there is an abnormality in the venous return due to increased hydrostatic pressure. Due to increased hydrostatic pressure, a venous return is impaired. But why venous return is impaired, or if is it associated with any disease or any condition or any systemic condition? Yes, this is associated with many conditions. Impaired venous return can be seen in congestive heart failure. Most important condition and the most common condition is congestive heart failure, and the second one is constrictive pericarditis. Then liver cirrhosis is also important. Uh, then venous obstruction or compression, like in deep venous thrombosis in lower extremities, and the thrombosis you have already studied about the thrombosis cause obstruction. So when obstruction occurs, then venous return gets low. And then external pressure due to mechanical or external pressure on the veins mechanically gets pressurized. So when veins gets pressurized, intake of interstitial fluid into the veins gets disturbed. So prolonged inactivity of the lower extremities also involved in the impaired venous return, or it sometimes cause the DVT. Then if if we talk about the arteriolar dilation is a cause of increased hydrostatic pressure, then heat may cause may cause release of more fluid from arteries into the interstitial spaces, and neurohemorrhageal dysregulation is also a major cause. So these are the causes of increased hydrostatic pressure. And the second one is a major cause. Second major cause is reduced plasma osmotic pressure. In other words, we say hypoproteinemia. We I have told you that osmotic pressure or colloidal osmotic pressure in our blood is due to the presence of proteins, and in plasma protein. In our plasma, there are three major types of proteins: albumin, globulin, and fibrinogen. Okay, so albumin involved in many major functions. Globulin is actually involved in immune system. Then fibrinogen is actually a clotting factor. So these all are actually involved in the maintenance of osmotic pressure. They creates actually osmotic pressure. So think if these proteins are involved in creating of osmotic pressure in blood. And if albumin is a major portion, albumin is actually no, almost half of the total protein volume in our plasma. So if albumin deficiency occurs, or albumin deficiency in blood occurs, then osmotic pressure gets damaged many times. Okay, so so in short, if protein deficiency in a healthy person, or in a human body occurs, then this condition is hypoproteinemia, and this will cause decrease in osmotic pressure, because plasma osmotic pressure highly depends on the presence of albumin, concentration of albumin or concentration of protein, and the major protein is albumin. So we can say albumin is a major role. So why albumin why albumin can cause osmotic pressure reduction. How? There are two conditions. If albumin production is low, or we, in other word, if albumin synthesis is low, then it means albumin production or synthesis is low. It means our body is unable to compensate the need of albumin. Okay, so because production is low. But on the other hand, if production is normal, but body if production is normal, albumin synthesis is normal from liver, but on the other hand, albumin is getting lost from our body in the form through urine. Okay, so if albumin if body is losing albumin from the urine, from our body in urine, then all albumin will also then concentration of albumin gets low in our body, in our blood. So these all conditions are actually associated, then in finally can cause reduced plasma osmotic pressure. Okay, so protein losing glomerulopathies, why albumin loss or leakage of albumin can occur in many kidney diseases like nephrotic syndrome, or then insufficient albumin formation can occur in liver cirrhosis, because liver is a major organ involved in the albumin synthesis. If liver gets damaged or liver cirrhosis occurs, then there are huge chances of the decrease in albumin due to decreased synthesis of albumin. Then malnutrition, it means if anyone takes insufficient protein on daily basis, then body can also lead toward the malnutrition. Then protein losing gastroenteropathy, it means there is any GIT condition in which body is losing albumin from plasma, then it will also cause reduced plasma osmotic pressure. Then lymphatic obstruction is also involved in the edema. For example, in case of inflammation, or we can say in case of any infection, when inflammatory mediator release, then if any due to any huge inflammatory or cells or phagocytic cells gets damaged in the lymphatics, and we can say inflammatory obstruction. Or if there is any tumor mass arised from anywhere and gets obstruct in the lymphatics, then it also cause edema. Post surgical edema is also common. So post irradiations can also cause lymphatic obstruction. Sodium retentions and water retention is also very important, because there are two mechanisms involved. First one is actually there is a two mechanism involved. First of all, renal hypoperfusion and the renal angiotensin aldosterone secretion. There are two mechanism, actually physiological mechanism. When sodium gets when excessive salt intake with renal insufficiency occurs, then sodium remain in body, then it will cause edema. We will discuss all these things in our coming slides. So first cause was increased hydrostatic pressure. So how increased hydrostatic pressure can cause edema. First of all, why are first and major cause is decreased venous return. Hydrostatic pressure gets increased in when decreased venous return occurs, and mostly it can be observed in a patient with deep venous thrombosis. Okay, when venous pressure in deep venous thrombosis, there is a low venous return. So when decreased venous return toward the heart or low venous return toward the heart, then interstitial fluid will move less in these blood vessel as compared to normal circumstances. So this is actually due to deep venous thrombosis or any obstruction in the veins and decreased venous strength toward the heart. Then generalized edema. What is generalized edema? Due to increased hydrostatic pressure, we can observe generalized edema in the body. Okay, means anywhere in the body. So it is a generalized edema in the body, and common cause of generalized edema, generalized edema can be observed after congestive heart failure. Okay, so congestive heart failure, how involve in edema? In congestive heart failure, reduced cardiac output occur because heart is getting failed. So reduced cardiac output occurs. When reduced cardiac output occurs, then systemic venous congestion occur. It means when blood is not coming toward the heart from the veins, then blood starting pool in the veins, or blood start gathering in the veins when blood remains or starts remaining in the veins, then it is a systemic venous congestion. And due to systemic venous congestion, hydrostatic pressure in the vein gets raised. Okay, so when hydrostatic pressure in the venous side gets raised, then difference between osmotic pressure and the hydrostatic pressure in the vein gets low. When difference gets low, then there are decrease intake of fluid from interstitial spaces into the venous return into the veins getting disturbed. So reduced cardiac output is an when congestive heart failure occurs and there is a reduced cardiac output. When reduced cardiac output occurs, then increased hydrostatic pressure in capillaries, because when usually capillaries get uh, because there is a pressure on venous system. When veins are suffering from increased hydrostatic pressure, then on the other hand veins are attached with the capillaries, so ultimately reduced cardiac output also caused increased hydrostatic pressure in capillaries. Okay, so reduced cardiac output is also can cause hypoperfusion of the kidneys. It means when cardiac output is decreased, and then then heart is unable to supply proper or normal normal volume of blood to the other body tissues. Okay, so when kidney is unable to receive a proper quantity of blood from the heart due to congestive heart failure, then there is a mechanism get active, which is renal angiotensin aldosterone axis. Okay, renal angiotensin aldosterone when gets activated, then it causes sodium and water retention in body, because we can say patient is moving toward the shock as well, or we can say okay, heart is getting fail, and the body needs more fluid to maintain. So when sodium and water gets retented in it, then due to more retention of sodium and water, hydrostatic pressure gets also increased. Okay, then it will also cause can cause edema. Then compensatory mechanism is in sometimes when compensatory mechanism occurs, then increase blood volume, uh, increase blood volume. For example, when a body is suffering from any disease and body needs to compensate the conditions, then more blood is formed, or more erythropoiesis occurs. When more blood is formed, then fluid retention retention occurs. When fluid gets retention, when fluid retention occurs, then increase pressure gets increased due to more fluid. So it will cause more worse edema as compared to others. So in compensatory mechanisms, edema can also occur, and sometimes it will cause more severe edema. An important assignment for you is a hyperaldosteronism. I will tell you later कि आपने कब तक सबमिट करवानी है. There are two another important causes. First one is reduced plasma osmotic pressure. So how osmotic pressure in blood vessel gets decreased? I have told you about the importance of protein albumin in our blood. So these proteins are actually involved in the creating or maintaining or establishment of the osmotic pressure or colloidal osmotic pressure in our blood. So due to decrease in albumin, okay, due to decrease, I am talking about a wide term, decrease in albumin, and decrease can occur due to decreased synthesis or decrease intake or more release of albumin from body. Okay, so decrease in albumin, regardless of any way, can cause decreased plasma osmotic pressure. So when plasma osmotic pressure gets reduced, then it will cause edema. Okay, so maintenance of osmotic pressure is also like when hydrostatic pressure is important, on the other hand osmotic pressure is also important, because intake of fluid from interstitial spaces highly depends on the osmotic pressure. So if blood has not proper osmotic pressure or protein, then it may be fatal. Then how osmotic pressure gets reduced? When plasma albumin gets reduced, then decreased colloidal pressure of blood and loss of fluid can occur. Okay, so these are all from Robbins. So another important thing in which albumin loss is more important. There are many diseases in which we can observe loss of albumin or loss of proteins, but a common and the major condition is nephrotic syndrome. In nephrotic syndrome, most important cause of albumin loss from the blood. Nephrotic syndrome actually a most important cause. In nephrotic syndrome, what happens actually, in nephrotic syndromes, it is actually related with the nephrons or weakness of nephrons from capillaries of nephrons. uh, 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 Capillaries from of nephrons, albumin gets leak, or in some or in other ways we can say capillaries of nephrons gets more leaky. Okay, then when albumin gets leak from the capillaries of glomerulus, then more albumin can be seen in the urine. So when there is a great loss of albumin in urine, then it will cause edema, and you can say their great loss is due to nephrotic syndrome. Then severe liver diseases. Another important cause is severe liver diseases. There is a now in what is going on in this, actually your if a kidney is normal, albumin is not getting loss, but liver is not functioning due to any hepatocellular carcinoma or liver cancer, or due to any chronic disease, or due to any cirrhosis, any due to anything, liver is not working. If liver is not working and liver is not producing albumin, because in our body albumin actually forms within the liver, and if liver is unable to form a proper amount of albumin, then reduced protein production occurs in our body, then liver diseases will move toward the stepwise edema. Okay, first of all, a reduced intravascular volume of of protein occur when reduce IV volume occur, then renal hyperperfusion will occur because kidney because when albumin gets low, when albumin production gets low, then volume of blood also gets low. When volume of blood gets low, then volume then blood movement toward the kidney gets slow, and kidney will face hypoperfusion. And on the then this then when due to this will ultimately lead to what decreased plasma osmotic pressure, and this is actually hyper एल्डोस्टेरोनिज्म. ओके, सो ये सारी बातें जो हैं ये हैं osmotic reduced plasma osmotic pressure. Then another cause is lymphatic obstruction, and in lymphatic obstruction what happens actually in lymphatic obstruction, low resorption of fluid from the interstitial space. There is, in simple wording, our lymphatics are involved in the taking fluid or waste from our blood to the from blood to the out of the body. So lymphatic system actually a excretory system in our body. Okay, so lymphatic due to any obstruction in the lymphatic system, it can cause edema. How it can cause edema? When obstruction occurs in lymphatic system, then lymphatic vessel or lymphatic vessel will unable to take fluid intake of the or remove the fluid from the tissue. So when obstruction occurs, then low absorption of fluid from interstitial spaces occurs. So when due to localized obstruction, we can say that these can also occur due to localized obstruction, and obstruction can also occur due to inflammation, because in inflammation many phagocytic cells are there, many bacteria are there. So when they collectively move in the lymphatic obstruction, they can cause temporary obstruction in the lymphatic system. Okay, so if there is any cancer or there is any tumor in the lymphatics or near tissues, and these tumor cells move in the lymphatic and obstruct in the lymphatic channel, then it may also cause lymphatic obstruction, and edema can happen. Another condition is filariasis. Is actually a parasitic disease in which a special type of parasite can cause swelling of lower extremities or legs. For example, we can say this is actually filariasis. In filariasis, edema of lower extremities occurs, and not it is not a mild condition. It's actually a very edema will occur in a very huge fashion. Actually, it's a very large edema. Eggs will show like elephant. So if we say it's elephantiasis, uncontrolled edema actually occurs. So we have to kill the parasites in this condition, and then this will remove elephantiasis will be finished. Then another cause is infiltration and obstruction of the superficial lymphatics by the breast. This is an example. So in breast cancer, usually superficial lymphatic obstruction can occur due to tumor part of the breast. ठीक है, then it can cause edema in the superficial skin in the breast. Then complication of therapy, it also in lymphatic obstruction can occur due to complication of therapy, or due to we can say that many drugs are actually marketed with they have a side effect of the obstruction in lymphatics. So complication of therapy can also involve in the lymphatic obstruction, and ultimately the edema. Severe lymphedema of an arm is an example of the lymphatic obstruction, which can be seen in the severe breast cancer condition. I have already told you that what hydrostatic pressure is occurs due to fluids or salts or due to water, we can say. So when sodium and water remain in blood in high amount, or stays in blood in a high amount, then it will cause increased pressure, and this pressure is actually hydrostatic pressure. So excessive tension of salt is actually involved in the increased hydrostatic pressure, and this will reduce the plasmosynaptic pressure. Okay, because net result will be decrease. So when plasmosynaptic pressure gets decreased, then it will cause edema. So increased hydrostatic pressure due to excessive salt and water retention can lead to the edema. And another thing is diseases which can cause salt and water retention in our body. There are acute renal diseases in which acute renal disease or conditions in which salt and water can can stay in our blood, or can not move from the out of the body. Another condition is post streptococcal glomerulonephritis. This is actually a disease of glomerulus due to special types of streptococcal bacteria. So after streptococcal infection, glomerular disease can occur. This disease occurs due to the actually accumulation of immune complexes on the glomerulus basement membrane. So due to after this reaction, after this water can not water and salt will not filters from the will not be reabsorb, will not actually filter from the kidney. So filtration damage or excretion will not occur in proper way. So when excretion will not occur, then these fluids or salts will remain in our blood. Okay. So now here you can say a few clinical features of edema. Edema can be mild, or it sometimes if remain untreated, then it will lead toward the severe form. Okay, so edema can put pressure on your surrounding tissues, or it is not always severe, but it can be severe in many conditions. So mostly subcutaneous edema may be due to the renal or cardiac causes. So when subcutaneous edema occurs, then you must have to go for the renal and cardiac checkup, because if there is no renal and cardiac cause and subcutaneous edema will occur, then it will be a very rare cause. So subcutaneous edema mostly occur due to any renal and cardiac abnormal conditions. So if there is any subcutaneous, I am going to repeat it, if there is any subcutaneous edema in your in any body occurs, then you must have to check the renal and the cardiac function of the body. So then can impair wound healing and clearance of the infection. So edema can also involve in the wound, can impair the wound healing, because due to pressure, due to accumulation of more fluid, and due to sometimes accumulation of exudatory material. Okay, so edema can also involve in the delay in wound healing. Okay, and clearance of infection as well. Pulmonary edema, there is a special example here. Pulmonary edema mostly occur due to left ventricular failure, because from left ventricular failure. So but also in renal failure and acute respiratory. Common cause actually pulmonary edema is left ventricular failure of heart, but there are rare cases like renal failure is also cause acute respiratory distress syndrome. Syndrome is also also a cause of it's not common, but it can cause pulmonary edema. And in pulmonary edema, fluid will can be accumulated in lungs and can push pressure on lungs. So it is not a very mild or a common or a relaxing condition. Okay, so there is another condition is cerebral edema. Cerebral edema is very threatening cause, because in brain accumulation of fluid, and accumulation of fluid is not good, and the removal of fluid is actually very poor. So brain or cerebral edema can cause severe conditions. Okay, so these are actually clinical features of edema, and we have talked about the pitting and non-pitting edema, and some basic causes, or and the exudate and transudate. So this is the end of this topic. Thank you so much.